The Osler Medicine Survival Guide is a point-of-care Android and iOS app that provides evidence-based direction for other clinicians on the care of hospitalized adult patients. We cover everything from the management of inpatient management of diabetes to taking care of patients who have had strokes or heart attacks.
The biggest challenge actually for physicians is to know what to do in real time for the patient that's right in front of them. As you're walking to the emergency room to admit a patient, you'll know which laboratory tests you should order for a patient with this diagnosis. As you're at the bedside of a patient, what types of exam skills what kind of exam maneuvers you should perform on that patient in order to see the severity of illness and what you might want to do next. It also helps you decide what therapeutics to begin with that particular patient or what type of therapies to administer. So it really is meant to provide immediate point of care information that is evidence-based and that can help provide the best care for the patient in front of you. So the guide is written by clinicians that practice this medicine every day. It's written by the house officers of the Osler Medical Training Program. It's a guide that actually started 21 years ago when the senior residents started to codify what they did and what they learned in the program for the people that came after them. So for their junior trainees, they would start to write down, for this type of patient, you have to think about A, B, and C. For this type of patient, you have to do 1, 2, and 3. And as they started to write these things down, and again, as the aggregate of information became larger and larger, it evolved into a book. And that book was then printed, and it was printed year upon year. And one thing that we've done with the Osler Medical Survival Guide is that we have updated it every single year. So year upon year, every chapter within it is updated. And it's not updated by the same person every year, it's actually updated by a new group of senior residents who's able to assimilate the current data and the current evidence, and someone that actually is immersed in the training environment and in the hospital wards, so that we can make sure it also is easily accessible to the people that will be reading it. Each chapter is additionally reviewed by a senior faculty member that's an expert in that particular content area.
The app is organized by medical specialties. So there are topics under cardiology, under pulmonology, endocrinology, and etc. But also unique to our application is a chief complaints search. So you can look just by shortness of breath or nausea and vomiting and kind of go down a pathway that way to access articles. As an intern, I use the guide constantly. When you're new to medicine, it's all very overwhelming, and there's so much information to keep track of that having a lead into taking care of a patient is just so invaluable. So the audience, when the guide was originally authored, was other house staff, other residents. But with the Osler Medicine Survival Guide app, we've broadened that to include all clinicians. So whether it be resident physicians in internal medicine, emergency medicine. We also are reaching out to nurse practitioners and physician assistants.
As we developed the guide and as we created the content of it, it became more and more clear to us that what we're writing down is not only relevant to the trainees here at Johns Hopkins Hospital, but the content is actually relevant and pertains to medical care really throughout the country, and I would argue throughout the world. And our hope is that the effort that we've made in putting this into a format that's easily usable and ideally provides evidence-based practices for the learning physician, that we're able to disseminate that, again, to others outside of Johns Hopkins.